Wrap a hand cone of desired size with paper toweling and tuck the ends of the toweling inside the ends of the cone. Dip the cone in water to wet the paper toweling and set aside. Heat the hand portion of the splint and cut out the center area as shown, maintaining a border of at least 1¼ inches. Use the cutout portion to wrap around the cone. The wet toweling will prevent the cone from adhering to the thermoplastic material. Press the overlapping edges of the material together and remove the cone and toweling. Trim the ends of the thermoplastic material as needed. Heat the remaining thermoplastic splint material and cut off the 2 tips of the distal end of the splint. Place the cone made from the thermoplastic material in the patient's hand and position the heated material over the dorsum of the patient's forearm after protecting the skin with stockinette. Fold the distal projections of the splint in half and place inside the ends of the cone, pressing to form a bond. Pull the splinted material covering the forearm proximally. Press the seams together on the distal projections and fold back the edge of the material over the wrist. Carefully trim the proximal end of the splint to approximately 2/3 the length of the forearm. Mark the sides of the splint at 1/2 the width of the forearm and carefully trim away any excess material. Straps for this splint are placed just proximal to the wrist and at the proximal end of the splint.